Good afternoon and good morning to everybody. On behalf of the European Foundation for Democracy, I would like to welcome you all to this policy discussion on this period we've all gone through in terms of impact of the COVID-19 pandemic, but more specifically on how countries and governments, and in this case, the United States, have responded to the challenges posed by COVID-19 and by the health emergency in terms of providing aid, support, guidance and training, and we'll hear more details from our guest speakers. I would like to thank all our guests representing USAID, starting with Assistant Administrator Bierman, and the country directors in Armenia, Deborah Grieser, Erik Janowsky from Skopje in North Macedonia, and Scott Hocklander from Chisinau in Moldova. This webinar is part of a joint program that we are implementing in cooperation with the US mission to the European Union. The goal is to examine the different type of responses and how we can challenges and how we can move forward. On a technical point, all attendees can write questions by using the function, the Q&A function at the bottom of your Zoom screen. The discussion will go on for about 1 hour. After introductory remarks, we'll move to Q&A. And with that, I would like to give the floor to Bierman to have, if you could set the scene for us, and we'll go then to the country directors to just get a better sense of the challenges on the ground.
Discussion. So thank you for the opportunity to discuss USAID's unprecedented response to COVID-19 in Europe and Eurasia and across the world for that matter. For decades, the United States has been the world's largest provider of bilateral assistance of global health, putting countries across the world in a better position to respond to this global crisis. Since the outbreak, the United States has mobilized as a nation to combat this virus, both here in the United States, at home and abroad. And we've committed more than $12 billion for international COVID response, of which more than $1.3 billion is coming from USAID and the State Department alone. With that $1.3 billion, our work is attacking this pandemic from a variety of fronts. We are providing state-of-the-art ventilators, improving public health education, and protecting healthcare workers. We're also strengthening laboratory systems, supporting disease surveillance, and boosting rapid response capabilities and capacities in more than 120 countries around the world. And in the Europe and Eurasia region alone, the United States government through USAID has committed over $103 million in emergency health assistance. And what you really need to know is that USAID and the State Department are not only working, across the Europe and Eurasia Bureau or region, but we're working across with the U.S. government, with the CDC, the Department of Defense, and others in an all-American response. So it's not just the United States Agency for International Development and the State Department, it's an all-of-American response. Our assistance across the globe is supporting countries affected by COVID-19 by providing high-quality and transparent and meaningful assistance. And we're working directly with governments, NGOs, and the private sector, both on the ground around the entire Europe and Eurasia region. This includes supporting on the front lines workers who are at most risk, caring for all of those impacted by the disease, and equipping local communities with the tools that they will need to fight COVID-19. Listen, let me emphasize that USAID delivers more than just funds. It delivers expert technical assistance, training, and life-saving diagnostic treatment. Turning to Europe and Eurasia, specifically, our legacy of support to the young democracies in this region goes well beyond health assistance. We've been in this region for almost 30 years, and we've done an incredible job of strengthening democratic institutions and growing the private sector to foster civil society and independent media to help during this pandemic. And years of our partnership have prepared our partners for this very moment. At USAID, we see direct lines between our support for democracy and good governance and the successful response of our partner countries to this pandemic. This crisis underscores the need for effective public messaging, governmental oversight, and accountability to all citizens. Democracy works best when we all step up and work together, and we see many examples of governments and citizens doing just that. For example, let me just tell you a little bit about what's going on in Ukraine. Local governments have leveraged USAID investments and technology upgrades to hold official business online and effectively communicate to rural communities while they maintain appropriate social distancing. In Kosovo, USAID's work to strengthening the transparency and effectiveness of judicial systems have helped Kosovo to continue court operations and during this pandemic. While in Georgia, USAID's support of youth volunteers formed a digital task force to share crucial public health information, support vulnerable members of the community, and counter disinformation about COVID-19. In Moldova, and our mission director is here with us today, and he'll share a little bit more about that. But let me just say that USAID is helping small businesses pivot to e-commerce opportunities. We're supporting similar efforts in Albania and North Macedonia. This builds on decades of partnerships with small businesses and entrepreneurs, the work that we have made a mainstay of USAID's work over the last 3 decades. And across the region, we're working to provide energy sector partners with the tools they need to keep the power flowing, while also planning for a longer-term energy security. As you know, we've committed $50 million in Italy, one of our closest allies. We are proud to support Italy, one of the hardest hit countries in Europe with the COVID-19 response. We are also responding to the secondary impacts of COVID-19 on democratic development. For example, our regional programs are assisting local civil society to provide a lifeline to vulnerable populations impacted by the crisis, including those experiencing domestic violence. Our programs are also supporting local groups and media outlets to combat a tremendous amount of disinformation being circulated about COVID-19. They're also monitoring local response efforts to the pandemic and sharing best practices on response strategies. Now, as I think about our work regionally, there are a few standouts. For example, USAID partner StarNet, a leading telecommunications company in Moldova, is helping to bring internet access to newly opened COVID-19 triage center in Moldova. And in 2019, USAID supported StarNet to start up the Moldova's first digital park. In the past, the founder of StarNet participated in USAID-supported junior achievement programs, which equips young entrepreneurs with the skills needed to start their own businesses. So you can see the connections that we've been working on, not just now, but throughout all of our work in our region. In Bosnia-Herzegovina, USAID founded USAID founded 3D printed lab that has inspired young people in the area to print plastic shields for first responders. In Azerbaijan, a young woman who opened her own tailoring business with USAID support is now producing face masks for her community. Across the region, the USAID supported European Democracy Youth Network, EDEN as we call it, is responding to COVID-19. EDEN is a coalition of young civic political leaders from across Europe and Eurasia who believe in democracy and the need to build bridges. Members of the network are helping their communities during this difficult time. Ukrainian members are organizing food to the elderly. Another member, who is a doctor, is serving on the border between North Macedonia and Kosovo. They're also leading social media awareness campaigns, informing young people how to stay safe in their communities. The most remarkable aspect of EDEN is watching young people work across political lines to solve problems. There's never been a more important time that we work together to solve the issues that are occurring because of COVID-19. And these are just a few illustrations of what is happening across the region and how our decades of partnership is paying off. And let me just say that partnership, Roberta, is the key word. Without a strong partnership, we cannot be successful. It is our mission at USAID to empower the countries and organizations we work with to solve their own development challenges. While COVID-19 may be an international threat, its wake is wide and varied, hitting everything from hospitals to the energy sector. Our response to COVID-19 must be tailored to the unique needs of each partner country And our partners are in the best place to know exactly how we need to help on the ground. We're also eager to find opportunities to collaborate with all of our partners throughout Europe, including DG NEAR. We have great partnership with Katerina Matharova and her folks from DG NEAR, and we've had ongoing discussions, and we've actually worked with them very closely to support civil society across the region. And so it's not a new partnership, and we're looking to expand in all sectors, including cybersecurity and disinformation. It's important to get people the information they need, and we're looking forward to working with DG NEAR as well as other partners in Europe to expand our opportunities to help people during this crisis. Before we dive into the discussion, though, Roberta, I also want to conclude with this. We must remain vigilant to stand together in responding to this pandemic, which is far from over. While the U.S. government continues to respond to COVID-19 at home and abroad, we will also continue to support our partners across the region and across the world. Again, there's never been a more important time to come together to fight this global pandemic. Thank you very much.
Thank you, Brock. That was a very interesting and very helpful overview. And one of the main takeaway that I have is the complexity of the crisis, and the complexity that of the response required. As you mentioned, is not just about either money or food. There are multiple dimensions and layers. I'd be interested to hear from the country directors how they've been dealing with the challenges on the ground. You've been the closest to the recipients, not only at government level, but to see the impact that you're having, or where you still have gaps to fill. Deborah, maybe we start with you and Armenia.
Sure, thank you. Well, for the viewers who don't know, Armenia is a rather small country with a population of only 3 million, but we have more than 25,000 confirmed cases of COVID. So there's been a very heavy caseload, one of the highest per capita in the world. So USAID has provided more than $6 million in new assistance, and this has included emergency health funding to strengthen lab capacities and to support the most severe cases of COVID. But we've also done things like supported vulnerable families with 8,000 packages of hygiene and food support, working through a local partner, the Armenian Red Cross. We've also partnered with our Ministry of Diaspora, or our High Commissioner for Diaspora, and we did something when we received sort of an urgent call for mobile medical units as the caseload was rising, and now that we've been several months into the crisis, the Armenian doctors are exhausted and needed some outside support. So we had been working with our the High Commissioner for Diaspora on a program that had been doing Zoom meetings. We were Zooming in doctors from the diaspora to provide technical advice to Armenian doctors. And so we sort of built on that relationship and reached out to see if we could find some doctors who would be willing to come to Armenia to assist with the effort. And we were very lucky to get a group of French doctors. So we cooperated with the French and they brought in a team of 15 doctors. And this was really, really helpful. You know, not just for, the work that they did, but it provided a real morale boost for the country. And it was also kind of catalytic. This was the first group of outsiders who came. And after that happened, then the French government kind of stepped up and said, okay, we're gonna send in a team to follow up on that visit. And they did so. And then following that, the Lithuanians have done so. So it's been a whole collaborative effort with other donors. I don't want to speak too long, but I just want to mention that in addition to new assistance, virtually all of our programs have sort of adapted or pivoted to provide support for COVID. So like our media program, for example, has a platform that they've been using. They've done webinars and for journalists and media outlets, and they're doing a lot of training on fact checking because of the misinformation and disinformation that's out there regarding COVID. This is highlighting, this is a place, a platform where Armenians can go and say what's really behind this, what's the source of this information, and what's really true. So we have done a lot more, and I could go on, but I know my colleagues want to speak, and I want to leave time for questions, so I might pause there.
Thank you, Deborah. Let's move to Scots and North Macedonia, right?
No, Scots Moldova. I'm USAID Moldova.
Oh, Scots Moldova. Sorry.
Yeah. No, that's okay. No worries. Yeah, thanks, Roberta. It's really a pleasure to be here with the European Foundation for Democracy. What I'm going to do is present just a little bit of a snapshot in time of how our thinking and our portfolio evolved, and I think you hear a lot of similarities with what Deborah just talked about, as well as I think Brock gave this really tremendous sort of overview of all the different things that the USAID is doing in Europe and Eurasia, and really this is a story of how our mission really embraced digital as a means of really reorienting our activities towards the COVID-19 response. Just quick snapshot in Moldova, we have two sectors: democracy and governance, and economic growth. I think in a lot of ways, our portfolio or our reorientation was set up for success based upon what we had to start with. In economic growth, we have a center of excellence for IT. We have competitiveness projects that work across some very key sectors, including agriculture. On the democracy and governance, we have community development projects. We're already working on improving the connections between citizens and their local mayors and other governance structures, as well as in justice. So I think that really set us up for success. This is a three-part story. The first part was really about using digital during those urgent first days, and a lot of that had to do with really making connections between us, between our implementing partners, and between our beneficiaries, between everybody really. And for example, we work with 47 mayors, really helping them to develop platforms between them and other mayoral offices, as also with their constituents. We worked with courts to connect them to detainee centers to provide remote justice. We had online tech events to promote innovation. We also worked in terms of helping to secure the food supply with our high value agriculture project, connecting farmers and ag processors who were really export focused to also to look at the domestic market. Part two was really, I think, several weeks in when we started thinking, okay, there's going to be a huge period of recovery. How can we really, help our sectors, and this is primarily a focus on EG, really develop resiliency? I mean, these facts are not unique to Moldova. 98% of the firms are small and medium enterprises. Up to 90% of all these firms have been impacted by by COVID, decreasing sales, et cetera. We were really concerned, about, we've made huge investments over the years in this area, and we knew that it was going to be important to help them recover. Roughly a third of the economy in some way is touched by the sectors that USAID works on in Moldova. So we worked with our Center of Excellence to basically have them provide digital content, services, expertise, et cetera, to non-IT businesses. Through our competitiveness project, we worked with businesses to develop online platforms, websites, digital business, et cetera. So we look back, we ask ourselves, okay, great, we got it. But then we said, well, wait, we have the great websites, but are the goods and services actually able to exchange hands with the customers? And that really led us to the idea of e-commerce. We talked about it for some time, and it turns out that e-commerce was not something new. It had been talked about in Moldova for some time, but it never really had taken hold. And as we got in and looked into it, we realized there's some serious issues. Lack of proper legal regulations, lack of transportation services, customs, a bunch of areas. And so internally, we sort of did an inventory, like, wait, we got an IT center of excellence. We got great activities covering the key sectors. All we need is a structural reform program to help, work on these issues related to e-commerce. Well, we had one, and we had one, that had worked in the area of trade and commerce. We had one with great connections with the government. And that really basically developed or came into fruition in terms of bringing 4 of our activities together, which is something that, I think really happens, at least in terms of my career, towards one objective of working on e-commerce. This is definitely something that was a community effort. We're doing this in full support of the Ministry of Economy, who really were thinking on the same lines, and we're working on initial steps. And they really provided the political will and I think incentives that's really going to help push this forward. These activities in particular, they're also funded by the Swedish and British governments, so we have a lot of support. Other contributors, the World Bank, the European Bank for Reconstruction and Development, the EU, all working with Moldova's Organization for Small and Medium Enterprises. So at the end of this, we really are hoping upwards of 500 companies could be benefited by USAID assistance. We really think, we're on the right track here. A UNDP report, impact report just came out, and the key recommendations, really the top 2 were support digitizations of companies and support crisis adaptation through optimizing business operations. So that's really, I think what we're trying to do. I guess the other thing, in terms of the moral of the story, play to your strengths, reconsider timing. E-commerce wasn't available before, now it is, and technology. We had a lot of technology that was available that just really wasn't being used, and it really took COVID as a forcing function to bring technology to the fore across our portfolio, different parts of society. And I really think that the Moldovans themselves, in spite of the challenges of COVID, have taken it up and are making progress. So I'll stop there and look forward to the questions.
Thank you, Scott. Let's move straight to Erik and look at North Macedonia so that we can then compare notes, because we're hearing very, very interesting stories on what's been going on on the ground and the kind of response you were able to provide.
Thank you, Roberta.
Erik.
Thank you. I think Scott took most of my time, so I'll be very brief. Just kidding, Scott. I want to thank the European Foundation for Democracy. It's great to be with you all today. And thanks, Brock, for that overview. Before I started my management career at USAID, I was a health officer with USAID. And health is one of the areas where we've had the most robust foreign assistance across the world, but not so much in Europe and Eurasia. I got to North Macedonia. We've about a year ago, and we do programming in democracy and governance. We do programming in economic growth, private sector enterprise, and we do a lot of work with youth. Since independence, we've been partnering with North Macedonia since their independence. It's probably $750 million overall that we've spent, but only about 11 million of that was in health, and not for quite some time, not since the 1990s. But when this, as Brock said, this unprecedented crisis hit, I was really impressed with how quickly we were able to marshal resources. We now have programmed just over $2 million in health in supplemental funding for multilateral organizations. We're doing a lot of work with our partners and with the Ministry of Health to make sure that they have the right communications going out to the population on messaging about the measures that the population should be taking. We're doing a lot with hygiene and food kits and resources for underserved populations. And it's really touching to see the stories of these families that oftentimes were working in the informal sector and had upwards of 10 children, and they're no longer able to make a livelihood. Their kids struggle to continue with their education, and we've done a lot to be able, through our partners, to be able to reach them with supplies, with hygiene kits, with the things that they need to keep their families safe, and with the information, but also with services such as digital e-learning, connecting them with schools. So it's really been an amazing effort. In addition to a lot of that work with vulnerable groups, some of that 2 million has helped stand up the government of North Macedonia's Emergency Operations Center. And we've really just partnered very closely on their response. It's been, they've been lauded on their response, but we've recently had, like so many places, a spike in cases. So this is a battle that is ongoing, and we look forward to continuing that partnership. In addition to the new money that we were able to program, we, as my colleagues have done, we've redirected some of our existing funding to respond to the crisis. So we've done a lot with local nonprofit organizations. We've done a lot to reach victims of domestic violence with services, helping through a grant from USAID, helping the main their services online so that they could reach victims of domestic violence through online platform. We've also done research with the government to make sure that they understand the secondary impacts that this is going to have, and where to focus their economic measures to deal with the crisis and minimize job loss and the economic impact. We've done a lot of work also with the Ministry of Education. As I said, we've helped them stand up their e-learning platforms and improve teacher training to be able to deliver course content online, which under this current crisis has been really fundamental for continuing the education system in North Macedonia. We've also had partners who've worked with the government across all ministries to increase transparency, so that there are online portals where citizens can go and see what economic measures have been taken and where the money is being spent. And they've also set up, with USAID funding, a portal through the Ministry of Finance to be able to, so that interested parties, both in North Macedonia and outside, can donate funds for the response. And several donations have come in. So in the interest of time, I'll just leave it there. As I said, and as Brock mentioned, this is an unprecedented crisis, and I think it takes a whole of government effort. The fact that we have these partnerships in place that allow us to respond to the most pressing needs of our government partners in North Macedonia has really helped minimize the fallout. It's helped prevent infections, it's helped prevent deaths, but it's also, I think, setting us up to be able to recover as quickly as possible. Thank you.
And Roberta, if I might just real quickly add on, because I do want to take a minute just to recognize the leadership of these mission directors and the others that aren't on this call today for really transitioning during a very difficult time. It's a shame that COVID-19 caused us to get to utilize some platforms I think we probably should have been using sooner. But at the end of the day, USAID has been extraordinarily flexible. We're worked very, very hard on the ground. Our teams from top to bottom have been working around the clock to get this assistance out the door quickly and to try to help those most in need. And it's just been gratifying to be part of such a great response from USAID.
Thank you, Brock, for these final remarks, and Erik for the very interesting description of the situation in North Macedonia. Just before we open to questions, we have one from Zoom and a few others have come in by email and Facebook. We've heard from all of you how complex the situation was and the need for flexibility. But what were, in your experience, what have been the most difficult challenges? And I'm asking this question because we've seen chaos and confusion in the response everywhere, not just in region outside of Europe. We're talking about Italy, UK, France, Germany. Well, Germany was particularly effective in the response, but most countries have been facing major challenges. What was in your experience the most the new element, the new dimension that you had to face and you hadn't seen before, that in any way might have hampered your efforts?
Well, look, first of all, the world has never seen a pandemic such as COVID-19. And specifically, I would say that every country is facing their challenges in a different way, simply because they have different capacities and capabilities. But I think what would be really interesting is to have each one of the mission directors give us just a little bit of a taste of what would be different from their perspective. And of course, you know, we spread out the mission directors. So we've got one in the Caucasus, we've got one in the Balkans, and then we have what we call the frontline states, which are Moldova, Ukraine, and Belarus. So they can give you kind of a regional perspective as well. So I'll let one of the mission directors start. Debbie, if you want to start from Armenia, because frankly, you've seen a little bit of a rise recently, and so the COVID-19 response is far from over, but we're seeing new dynamics.
Sure, but I think that this government has done a really good job of communicating its message, and so we tried to be very supportive of them in doing that, and I think it's been effective because I think a lot of this pandemic, I mean, a lot of this, I mean, what we want to do is keep people from having to go to the hospital. We want their behaviors to change. And so we have not only like helped support them in producing messages, but then once they have produced messages, we boosted them on our social media platforms. And also when we have done online engagements, we try to, you know, we wear our masks and we socially distance ourselves. So we try to set a standard. But I think one of the challenges I think this government has faced is because it's a new government, has been in communications, but they've really stepped up to the plate and risen to the challenge in this crisis.
Thank you. Maybe Scott, Erik, would you like to add anything?
Yeah, sure. I'd love to. Yeah, first of all, just what Proc stated. You know, I've worked in disaster response through USAID for years, and definitely the fact that the whole world is basically dealing with the same pandemic at the same time was absolutely unprecedented. And so all the, you know, when you normally have these areas where you're going to get support, that support is also going through the same thing you're going through, and so it just takes so much more time, I think, for everybody to sort of work through it. The other thing I wanted to also touch on was just the communication aspect to it. It's been, I think, Erik, you mentioned it, Deborah, you mentioned it, Brock, you mentioned it. It's in terms of getting good information out there. And unfortunately, there is a lot of, I think, malign intent in terms of spreading disinformation. But there's also a lot of information just based upon, you know, lack of developed means of communication. You know, and in Moldova, we support independent media. In particular, we support an investigative media, Zero de Garda, who was looking into some of these stories that, you know, seem to sort of belie reality. And what they ended up finding, you know, was you know, in addition, you know, to I think some malign actors there, but also just some breakdown in communication sometimes between hospitals and the families of the patients, and just things like that. And it's just something that's so scary. You know, the pandemic it scares everyone, and everyone's looking for answers and for information. And it's almost, you know, really hard to believe that something like that could happen. And if you don't really have like good information out there describing it and giving people good guidance, it really is a struggle for folks.
Thank you, Erik.
Yeah, so thank you. In North Macedonia, when the crisis hit, they were led by a technical government because we were setting up for new parliamentary elections. And so the crisis has been handled under a technical government. The Ministry of Health has done a remarkable job, and they've let data drive the decision-making, which is critical for the response. But now we're in full campaign season for elections that will happen July 15th. And that just brings an extra challenge, I think, with not only disinformation, but just campaigning. I mean, politics can be a rough and tumble business. And so when you see an increase in cases, for example, it's an opportunity for one side or the other to have their talking points. So in the midst of that, we have to make sure that we and our partners are still communicating based on the data and making clear scientific and data-driven decisions and providing accurate information and not getting involved in the politics. I think the other thing is that, and this we're seeing this everywhere, is that part of this unprecedented crisis was the lockdowns and the distancing that were required. As we start to ease up on some of that, and yet the data then sometimes shows a need to maybe go back to a more conservative posture to protect people. It's hard to get that genie back in the bottle. It's hard. We're all, I think, in part suffering from the psychosocial effects of having to be socially distanced and to take on these measures, and more so or equally in the countries where we serve. So finding that right balance between looking at economic growth and making sure you minimize the consequences on the economy, but also making sure that people are safe. I think that's a challenge. I think it's a challenge everywhere, but we've been really impressed so far with the response from the government. And you have a Minister of Health in North Macedonia that's probably the public opinion polling probably rates him as the highest favorability of any government official. And it's because he's been communicating based on the data and the science.
Thank you all for this overview. You've all mentioned the importance of communication, facts, information, providing people with enough either technical tools for like their work and their ability to continue, but also communicating the correct information. And here we go to like the buzzword of this past 6 months: disinformation. Disinformation that is nothing new. We've heard it before, we've seen it before. It's alternatively called fake news or disinformation or propaganda. Now, what was interesting for me is that I've seen recently an infographic prepared by Radio Free Europe, Radio Liberty in Prague, that was absolutely brilliant, because what they said was that according to a survey in the Balkans, in particularly in Serbia, 4 out of 10 people believe that China was the largest donor during COVID-19, while instead it was by far the EU. And it's very interesting because, again, what I've just mentioned is not an isolated case. We've seen it in everywhere. I can tell stories and anecdotes of what has happened in Italy, but we've seen it in every country. What was your experience on the ground in this respect, and how much did it impact your ability to deliver and build relationship with the local population?
Well, look, Roberta, let me just tell you from kind of a 50,000-foot level that communications is an absolute priority. Making sure that we get the right information out to all our stakeholders is critically important. Making sure that we work across government lines, not just as an all-American response, but also as we work with our partners like DG NEAR. We have to work in concert with making sure that the right information gets out and that we utilize all of the different platforms and social medias that we can, and take opportunities like this Zoom webinar, if you will, to actually talk about the great work that's being done. It's incredible to see some of the disinformation. I'll tell you a quick story. I saw it firsthand when I went to Russia a few weeks ago to deliver ventilators, actually firsthand, and escorted those ventilators to Moscow. What was interesting is that, here we land, we deliver the ventilators, and I did a press interview, answered a lot of questions, and after I left, USAID wasn't even mentioned in any news article anywhere in the country. That's not to say some of the smaller, more independent outlets, but in the major publications, U.S. Agency for International Development was not mentioned. And I think that talks to some of the state control in Russia, but also the disinformation that's getting out there. In fact, they barely equated the donation that the United States gave. In fact, they more or less said it was a trade-off from what the work that, or from the assistance they provided, which wasn't the case. At the end of the day, look, I think it's important that we send a clear message, and we also send a clear message to the people in Russia, right? I think it's important that we make sure that they understand that we're working across country lines, party lines, to make sure that we provide the assistance that is necessary during this pandemic, and we do the right thing. And I think that will ultimately help us deliver that message. And we're going to continue to send that message. But I don't want to take up too much time, because I think that these mission directors can give you kind of a local taste for what that looks like at the community level.
Please, do you want to comment? And actually, let me, I'll give you the floor by, you can add to what was just said, but also I'd like to mention a few questions that have come in, and they're all connected. So first of all, I agree with what Brock just said, and that is your role, USAID's role, or DG NIR's role is to provide aid support of whatever is necessary on the ground, and not get involved in the politics. The politics, however, sometimes comes into anything that you're doing, even if you don't want to. So the big question is, how can you continue to be effective, to have an impact, while some messages are actually seeking to undermine the very work you're doing. So the questions that have come in are again along this line. One is specifically concerning Armenia, and that is how do you operate in countries that are under significant or big Russian influence, such as Armenia, and is it easy to cooperate with government, civil society organizations, and local experts in such countries? And also related, let me read this one, is in your respective regions, countries are in your respective regions or countries, are particular states or non-state actors actively promoting specific messages? So maybe we move to you, Deborah, since the first question explicitly mentions Armenia.
Yeah. The question is a good one. There is a lot of Russian influence here, but it really, I don't think it prevents us from getting our job done. I mean, I think that this government has good relationships with Russia, and they have good relationships with the European Union and the United States. And I think they balance this on a daily basis. They were balancing this before COVID came, and they've continued to manage it very well and balance it throughout the COVID crisis. I don't feel like it hinders us. I think sometimes because they are closer to Russia, because a lot of the media outlets are Russian sourced, so Russian messages are more easily transmitted. So it just makes us work harder to ensure that our messages are also being told. Yeah, I'll stop there and give others a chance to respond.
Thank you, Deborah. Erik or Scott, who would like to add anything to this?
Maybe I'll take first shot and let Scott clean up. I would say a couple of things. First of all, when it comes to our assistance and our partnership, it's important for us to just keep an eye on the prize. There are a lot of needs. So if other donors have something to contribute, that's great. Oftentimes what we find is that our assistance is delivered in a way and in partnership for sustainable development to help countries on their journey to a time and a place where they no longer need assistance from USAID. We build capacity. We leave. We have a real partnership of equals, I think, and that's valued by our government partners and by our civil society and private sector partners as well. So I think that our assistance is well received and welcomed always. When it comes to the disinformation, and certainly we've seen a lot of that. There have been other actors. You know, we provided over $2 million very quickly in assistance, and we're the largest of the bilateral donors in North Macedonia. But you would see a donation of 10,000 masks by the Chinese that sort of took over the front page of the paper. So they're very good at that messaging, the communication. But I think in addition to us keeping an eye on the prize, we also, as Scott mentioned, we have partners in the media space that are monitoring disinformation and fighting fake news. So we do, when we see stories out there that just aren't true, we help increase transparency and report that in fact those things aren't true, whether it be something on 5G or COVID related. So I think it's important for us to stay true to ourselves and our mission as a development agency. We partner for long-term sustainable development and look towards a day when the countries no longer need our assistance. So that really, that compass north, I think, helps us in delivering our assistance and being a good partner. And at the same time, we're interested in transparency, and we'll call out fake news when we see it.
Hey, before you go, Scott, let me just comment on that, because those are great points, Erik. Listen, I think that there's a major difference between assistance that is self-serving and assistance that is trying to create partnerships. And one of the things that I'm so proud about USAID, not just during this COVID response, but during its entire history, when President Kennedy set out and founded USAID, I think that the whole idea is to create partners, is to develop countries that are self-sustainable, that can help you help others in need. And at the end of the day, what I think that the communist China and the Kremlin playbook, if you will, is about dependence. It's about how they can, it's about dependence rather than independence, right? It's about what is in their best interest, is going to help create, if you will, more of influence in that government rather than more independence. We're trying to create more options for countries rather than less options. It's not about the USA versus Russia or China. It's about how that country makes its own decisions.
Thank you, Brock. Since we had Erik, we just received a question for you specifically. Milena Georgesca asked what you think could be done differently by the health officials in North Macedonia at this point to curb the spread of the virus. Sorry.
Thank you. I'm not going to get into second guessing government officials on the response. I think it's been very good to date. I think there are some challenges right now with the rising numbers of cases that have been brought to light because they're doing a lot of testing. They're testing of asymptomatic cases. They're doing contact tracing. So they're doing the right things in order to keep this under control and not overwhelm the health system. They just have to continue to deliver the messages to the population that they have been from the beginning. The importance of social distancing, the importance of wearing a face covering when out in public, or when you're not able to keep that distance. We, as Deborah mentioned, we at the embassy are trying to model that good behavior. and doing our meetings online. We're still in sort of our first phase of reopening where we don't have a lot of people in the embassy compound. And we're doing most of our, taking advantage of the technology, as Brock said, and doing our meetings the way this one is taking place. So I feel like the government has done well. They don't need me to armchair or, you know, to be a Monday morning quarterback. I think that it's always going to be a struggle once you begin to reach a certain fatigue and begin to reopen, to then go backwards. And I think that's true all over the world. So it's really, you know, Deborah mentioned behavior change. You know, it's one thing to communicate the important messages and to teach people about hand washing and everything. But changing behaviors is a tough, it's one of the toughest things we do as a development agency. And it takes a long-term commitment. And we're there to partner with North Macedonia for the long term.
Thank you, Erik. Scott, would you like to, we stopped the round, so it was your turn to add comments.
Yeah, I mean, you know, I think if there's something we struggle with is that we're always like focusing on the substance of the assistance as the first priority for us, and then communication, you know. And so if there's anything that's lost, you know, it's the communication, because we always want the assistance that we provide to be appropriate, to be timely, to be, you know, what's needed in the particular situation, and that's always going to take the precedence. So, you know, as far as communicating what we do, I think all of us at USAID, you know, understand that communication is part of our job too, though, and we're always working to improve it. But I think it's twofold. It's that, and then also ensuring that you know, communication in any country, whether it's, you know, Moldova, North Macedonia, or you know, Armenia, is able to go out freely, you know, in an independent media, you know, that can be consumed by an election or a population that is able to understand it, think critically about it, and ask questions, you know, when information is put out there that maybe isn't accurate. So, I mean, as I mentioned earlier, we definitely support independent media in Moldova, and as well as terms of strategic communication. You know, we're currently providing support to UNICEF to help really support the government in terms of providing it was extremely important messaging, which is I think Erik mentioned. You know, it's just critical in this particular phase of the pandemic, when you know, countries are opening up, and ensuring that people are, you know, utilizing all the safe practices they can, understand that, and are able to do it.
Thank you. You've all mentioned the fact that one of the secondary outcomes or the secondary impact of COVID-19 is democracy. And you highlighted some of the work you're doing. I'm asking a question that has come in from Facebook, and the participants is highlighting that elections have been postponed in many countries, including Eurasia, due to COVID-19. Is USAID addressing support funds towards elections during a crisis in a pandemic?
Absolutely. We are absolutely committed to making sure that we support all countries through the process. We are providing assistance in every one of our countries to make sure that the process continues and that people have the ability to get out and participate. But maybe rather than me talking first, I'd like to hear, maybe we start with Erik, actually, since the elections in North Macedonia he talked about earlier. So Erik, maybe we can get some perspective on the ground, and then from the other mission directors as well.
Thank you. Thank you, Brock. It's a great question. We were prepared as a whole of government approach in the embassy when elections were scheduled in April to do our monitoring and to support our partners like the OSCE and the government. We do have a long-standing relationship with the State Election Commission. We support them and have built their capacity and have helped them carry out successful elections in the previous 3 years. We were going to take a large and small footprint on this one in April, but after this pandemic, when the state of emergency ended and they scheduled the election for mid-July, we quickly went to USAID Washington to request some additional funding to support now in this new situation, carrying out the election, which they have always done very well. The challenge of doing it safely during a pandemic, I think, was one that we recognized they were going to need some additional support. So we've brought another $350,000 to bear on another agency within the embassy was able to get a grant to provide for personal protective equipment for not only poll workers and volunteers, but also to make sure that all of the things were in place to be able to, in each and every polling place, ensure that they could manage it safely and so that voters could confidently go out and vote. So it's been an approach that the whole embassy has taken to support this. It will still be a light touch in terms of monitoring, and of course, we're under the same restrictions during the pandemic that the citizens are. We're not going to send teams out overnight to go monitor things, but we're confident now that given this additional support, we've helped prepare the country to do this election in July safely and effectively, freely and fairly. So we're confident that they're prepared. We'll see what turnout looks like, but I feel like we were able to once again rise to the challenge and help the country get prepared for this election.
And I would just add, Roberta, that I'm having regular conversations with ambassadors here in Washington. Just had one recently with the Georgian ambassador, David Bakradze, about what reform is going through Parliament. And we've seen that reform progress, and they've actually passed reforms in Georgia just recently. So, I mean, look, it's an ongoing discussion. The nice thing about this type of platform is we can continue the discussion even though we're not meeting in person. And we're actually having regular discussions and holding our partners accountable for transparency during this time.
Thank you all. We're getting close to the end of the discussion, but I actually have a final question to wrap up a bit our exchanges. You mentioned cooperation with US-EU cooperation, your relationship and work that you've been doing with DG NEAR. What do you see as gaps, if any, or challenges moving forward, and what would be your key recommendations?
So I'll start off real quickly with that at the kind of 50,000 foot level, and maybe the mission directors can talk at a local level. Look, I think in my estimation, the closer we work together, not just collaboratively, but cooperatively, is going to be a benefit. So if we're working together in the same area, that's great. Making sure that we're synchronizing, if you will, our approach. And then secondly, if we're not working in the same areas, how do they complement one another? Also, I think continued conversations, not just at the 50,000 foot level, but also at the working level. So I have been working with Katerina to make sure that our colleagues at all levels are connected and have regular conversations. Look, at the end of the day, communications can help you be more successful, even as you provide the assistance. And so what we've agreed upon is having our technicians, right? People who are experts in media or people who are experts in energy independence are having those conversations, cybersecurity. We have to have more communications at every level to make sure we're linked up, and I hate to use this word synergy, but we have that synergy that creates a better response, and it's true. So at the end of the day, it's making sure that we're connected at every level.
Thank you. would you like, it'd be interesting to hear what kind of cooperation you have maybe with the EU delegations in your respective countries or countries of work. Deborah.
Yeah, sure. I wanted to say that we are in lockstep with our EU counterparts, not only our EU counterparts, but with other donors, including UN agencies. And in fact, because the government is so burdened right now, what we've chosen to do is sort of meet with the government as a group, so that we're hearing the same messages and we're understanding the needs as a group, and then we can, you know, okay, well, here's what the US can do to fill that gap, or here's what the EU. So we're actually kind of working it as a group, and that seems to work well here.
Yeah, I would say here in Moldova, we also have a very strong relationship with the EU. I mean, I think that's I think that's essential. You know, to the point where, you know, we contact each other regularly. We also, in terms of looking at our programs, we definitely not only work together, but also make sure that geographically speaking, we try to provide as much coverage as we can. I mean, in even pre-COVID, any kind of development resource is scarce, and it's absolutely, you know, critical that that all development partners are working together in terms of you know, not just coordinating, but also collaborating on projects, you know, in the beginning stages of developing ideas and then, you know, bringing them to fruition together. And so we definitely have that with the EU. We're funding things directly with, you know, the Swedish and British governments. We work with the Polish government. I mean, I think the cooperation is very good across the board. If I were to give maybe one piece of advice, and that is that, you know, we continue to utilize access the private sector in this. You know, I think the more and more as, you know, we look at, you know, the journeys, the different development journeys our countries are on, private sector has to be a part of that. And I think, you know, in the face of the challenges of this pandemic, the private sector has so much to give, so much to offer. Even though, you know, they are also, you know, suffering from this, they also want to be part of the recovery. And we certainly have seen that. Brock mentioned StarNet. You know, there's many other examples here where the private sector in Moldova has really stepped up and wants to be part of not only the response, but also the recovery. Thank you.
Thank you. Erik, do you have a final word?
We all recognize that the goal, for example, in North Macedonia, now that they've opened negotiations for EU accession at some point in the future, that's sort of where we're all, and of course being a NATO partner now, so that Euro-Atlantic trajectory, I think, is what drives our work as a donor community. I think that you know, coordination is hard. We all have our day jobs, and you know, I don't want to oversimplify that. It's a challenge. We need to avoid duplication, but we also, as Brock said, need to look for synergies and opportunities to for every donor to go to play to their strengths, and to maybe allow other donors to do something if they've got the budget and that's in their strategy. I think the other piece of it, of course, is that as donors, whether we're in a very poor country or a country that's middle income, we're really looking to government to coordinate us. And I think that ultimately in that journey to greater self-reliance and sort of independence from aid, it's incumbent on the government to really sort of play a lead role here. And that's something that I think, you know, we're going to have, whatever the next government looks like in North Macedonia, we'll be talking to them as USAID, but also as a donor community about the best way forward with the country in the lead.
And if I might just really quickly just add, it's not just about one partnership with DG NEAR, it's about how we look for partnerships beyond. And for anyone who's interested in providing the assistance that we both agree on is necessary and needed in this crisis, even Russia, we're more than looking to take opportunities to work together.
Thank you. Thank you to all of you for your very interesting insights and overview. I hope we will have more opportunities to host you to hear about the progress that is being made, that you're making, particularly because the situation is still extremely fluid, extremely volatile also. We're all still waiting about this second wave. Will it come? Will it not? Are we going on holiday? Is work going to continue? Are we going to see another lockdown? So there's a lot of uncertainty for all of us, and it'll be certainly very helpful and very interesting to hear about developments, and maybe bringing here also your colleagues from DG NEAR. So thank you for your time. Thank you to our all the attendees on behalf of the European Foundation for Democracy, but also on behalf of the US mission to the EU, which is with whom we are working for this series of webinars. Stay tuned. Next week we have another webinar, this time in French and in France.